Well, I'm Andrew Vallance-Owen. I'm a doctor, I'm a surgeon, trained as a surgeon, and for many, many years I've been an advocate of better information for patients to help them make better decisions, informed decisions about their healthcare. And what I want to talk about today is how we involve patients in making those decisions by use of measures which patients themselves can fill in, which tell us about the benefit they've received from their healthcare. And we call those patient-reported outcome measures, or PROMs. Patient-reported outcome measures are a form of survey, and what we do is we ask the patient to complete the survey before their treatment, so we understand what it is that's important to them, what they're looking for out of the treatment, and then after the treatment we send the survey to them again, maybe 3 or 6 months later, to ask them how was it for you? Did you gain a benefit from the treatment? And you fill in the survey and we see the difference between before and after. And that's very valuable to the doctors who are treating them, and in a wider sense when you collect that information together for patients coming to a website and finding out what sort of choices they make, which doctor they want to go to, which hospital they want to go to, if they can see what other patients have said in these patient-reported outcome measures. Of course, patient-reported outcome measures are not only valuable to the patient themselves and to patients following, but they're also very valuable to the doctors or surgeons who are treating them. Individually, if they see that data, they can see how well the patient did and can learn from that. And when they look at all their patients, perhaps over a whole year, which is the sort of thing that we might put on the PHIN website, they can get a much better sense of overall how they're performing, and maybe where there may be areas where they could improve for future patients who they're going to treat. One example of where a group of consultant orthopaedic surgeons really learned lessons, if you like, from the patient-reported outcome data was one of the surgeons was doing a lot of back operations and another surgeon was doing a lot of hip operations. But occasionally the back surgeon would be asked to do a hip operation and was doing them as an orthopaedic surgeon. But what the information showed, the data showed, was he was much better sticking to the things he did a lot, and vice versa on the other side. So they agreed in the end, the two surgeons, that one would do the back operations only and the other one would do the hip operations only, and both their results improved. Before you go to a hospital or to see a consultant, it's really important to get onto the PHIN website and to find out what the hospital's outcome results are, their patient-reported outcome results are, because you can pick up from there the benefit the patients are getting or not from that particular hospital. So that's the important first point. The second point is when you go to the hospital and see the consultant, for the purposes of the future patients coming on, please fill in the form. Fill in the first form before you see the doctor, but even more importantly, the second form, which will be sent to you or may be available in digital means or some other means at 3 months or 6 months later. It's really important you fill that form in as well, and again be as frank as possible about the benefit or not that you may have received, so that the before and after forms can be put together and we can see that benefit or not and feed that back to the doctors.